Today, I'd like to provide another update around testing, tracing, hospitalizations, PPE distribution, and the ongoing work of the Reopening Advisory Board. I also want to give a brief update on federal disaster assistance. On testing, yesterday, the Commonwealth processed 11,118 tests. We had 1,963 confirmed positive tests of COVID-19, which means about 17.7% of the tests conducted were positive. This positive percentage is an important piece of the data that we monitor, and that latest number of 17% is down from a previous high that was much closer to 30%, which is a good sign because we test a lot more than we did a few weeks ago, and we've also tried to test in places where we were particularly concerned about the potential of community and organizational spread. As I've mentioned, we continue to hold daily calls with leaders in the healthcare community and have been closely monitoring hospital capacity and hospitalization rates related to COVID-19 and other non-COVID related issues throughout the state. As of yesterday, there were 3,856 patients hospitalized in Massachusetts for COVID-19, which is quite consistent with our data of the past few days, meaning that hospitalization rates for COVID-19 have been pretty flat now for about 15 days in a row. The percentage of all cases that are hospitalized has also been pretty consistent. It's at around 6%. While we're watching for that downward trend that many people talk about, not just here, but in many other places with respect to monitoring and measuring the spread of the disease, the number of people needing hospital care here in the Commonwealth has stayed pretty consistent, as I said, for the better part of the past 2 weeks. Flip side of that was we haven't seen an increase for about 2 weeks as well, which is also a good thing. We also suffered yesterday, I think many people know, the largest single day increase of COVID-19 related deaths here in Massachusetts, losing 252 people to this insidious virus. We obviously track a lot of numbers to understand the presence and the trajectory of this pandemic, but the lives lost every day is one of those numbers that none of us is ever going to get particularly comfortable with. Behind those numbers, as I've said before, are people and families and lives that have been forever changed by the lethal grip of COVID-19, and our hearts go out to everyone who's lost someone to this terrible virus.